Morning to everyone. I am Dr. Shazia Jamal, Associate Professor in School of Life Sciences. I am going to deliver the talk entitled Protective Effect of Osmolytes Against NSAID, that is non-steroidal anti-inflammatory drugs. This is brief introduction about me. I did my graduation in chemistry honors and master in biotechnology from Aligarh Muslim University, Aligarh. I qualified the UGC NET JRF test and completed my PhD from Jamia Millia Islamia, New Delhi. After that, I moved to US for my postdoctoral research, and in 2013, I joined in present School of Life Sciences as assistant professor, and now I am associate professor here. Coming to my topic, that is about NSAID. So this is a non-steroidal anti-inflammatory drugs and a class of medication commonly used to relieve pain and reduce inflammation, and also it has antipyretic, analgesic, and anti-inflammatory activities. It is widely used against painful condition due to inflammation and non-rheumatic origin and acute attack of gouts. The anhydrous sodium salt diclofenac is one of the most commercial available, and it has been reported with adverse effect, especially renal dysfunction. So this slide shows different NSAID drug available and being widely used in different disease condition. But beside this, it is also having several side effects. For example, ibuprofen that is effective for pain relief and fever reduction, but it may cause gastrointestinal issues and increase the cardiovascular risk. Diclofenac, it is a potent anti-inflammatory effects, but it causes gastrointestinal ulcer and bleeding with cardiovascular risk. Naproxen, it is effective with less frequent dosing, but it may cause cardiovascular side effect and gastrointestinal effect. Aceclofenac is having strong anti-inflammatory properties, but it may cause gastrointestinal issues and cardiovascular risk. Paracetamol is safe for mild to moderate pain and fever, but it may cause high dose and affect the liver function. Aspirin acts as both NSAID and antiplatelet agent for preventing blood clots, but it can irritate stomach lining leading to gastrointestinal issues and bleeding risk. Mefenamic acid is effective for moderate to severe pain, but it may also cause gastrointestinal effect and carries cardiovascular risk. Celecoxib is target inflammation with lower risk of gastrointestinal issues, but it may cause the kidney problem and also the cardiovascular risk. Heterocoxib is having anti-inflammatory effects with potentially low gastrointestinal risk, but it may increase cardiovascular risk and cause fluid retention. So overall, we can see different NSAID which is used for different disease condition, but also they are having so many side effects. Coming to the osmolytes, let's see what osmolyte is. So organism under different stress conditions, they will accumulate low molecular weight organic compounds, and that is known as osmolytes. So stress can be anything, either salt conditions, water, heat, pH, and pressure. So the organism under these conditions will accumulate low molecular weight organic compounds. So let's see the function of these osmolytes. So osmolytes rescue the defective proteins and they protect the native proteins from proteotoxic intracellular environments. And they also stabilizes the macromolecules under the denaturing stresses. Let's see the examples. So we have three broad categories of osmolytes like amino acid and derivatives, polyols, and methylamine compounds, which includes different examples like glycine, glycerol, sorbitol, betaine, alanine, sarcosine, and so on. So the effect of these osmolyte on the functional activity of protein includes the osmolyte, which is divided into two broad categories. So the first category is compatible osmolytes and the second category is counteracting osmolytes. So this classification is done on the basis of their effects on the functional activity. So let's see what the compatible osmolyte is. So they increase the protein stability against denaturation with little or no effect on their function under native condition. So example includes glycine, proline, alanine, trehalose, sucrose, and sorbitol. While counteracting osmolytes have the special ability to protect the intracellular proteins against the inactivating and destabilizing effects of urea. So the example includes all methylamine compounds, that is glycine, betaine, and sarcosin. So let's see the mechanism by which osmolytes will help in protein stability. So this is explained by preferential hydration effect. So osmolytes are preferentially excluded from the protein surface, that is they cause preferential hydration of the protein. This effect favors the protein state with lower exposed surface. And this displaces the denaturation equilibrium N to D state towards the N state, hence bringing about the stabilization of the native protein in the presence of osmolytes. The same thing I have shown here as a pictorial representation. This is the native protein, and in the presence of stabilizing osmolytes, if preferential hydration occurs, then the protein will be stabilized. And if preferential binding effect will dominate, then the protein destabilization will take place. So that means there are two opposing forces that act on the protein in the presence of osmolytes. If the preferential binding effect dominates, then it favors the denaturation. If preferential hydration effect is more, then it opposes the denaturation. So this is the way how osmolyte stabilizes the protein structure. Now let's see the protein folding process in vitro and in vivo condition. So the protein folding process is entirely different in these two cases. So let's see what the difference they include. In vivo condition, all the information are immediately available for folding, while the other process is very gradual. So that means the in vivo condition, the cellular environment is very much different and it's much more crowded. So hence we can say that the protein folding process is very much different in these two cases. Now coming towards the main topic, that is how we can see that osmolyte will protect the protein against NSAID. This can be done by seeing the changes in the protein stability. Any drug can be selected and the stability experiment can be done on protein. So two aspect can be studied. The first one is thermal denaturation studies. This will give two different thermodynamic parameters by which we can conclude whether osmolyte is destabilizing or stabilizing the protein, and what is the behavior of different drugs and osmolyte. The second aspect is histopathological studies, that is the in vivo studies, by which we can see the tissue morphology and the physiology. Before going in detail, I would like to show one thermal denaturation curve of protein. So this is a thermal denaturation curve where the absorbance increases with increase in the temperature of the protein. So in the y-axis, the fraction unfolded is given here, that is from the 0 to 1. So we can see that at the beginning temperature from 0 to 10 to 40 degree, there is not much change in the protein. So this state is known as the native state or the N state. So beyond the 40 degree, we can see a drastic change is there. And after certain temperature, the protein is showing not much change. So that the last portion is known as the D state, that is the protein is being denatured. So if we calculate the temperature at which the protein is 50% denatured or the fraction unfolded is 0.5, then that particular temperature is known as TM. That is midpoint of thermal denaturation. So this is the parameter which shows the property of protein. So this parameter we have calculated to find out whether the osmolyte is stabilizing or the drug is destabilizing and to what extent. This is the again same thing where we have seen that the thermal denaturation in the presence of osmolyte and the drug. So we have the multiple curves here. Let's consider the middle curve, which is having the symbol with triangle unfilled. So when osmolytes are added, then the denaturation, we can see the denaturation curve is shifted towards the right hand side. While if drug is added, the thermal denaturation curve is shifted towards the left hand side, which shows the protein is stabilizing in presence of osmolyte and destabilizing in presence of drugs. To be more precise, we can actually find out the values of TM in the presence of osmolyte and in the presence of drug. So we can easily see that in the presence of osmolite it's around 50 degree, and in the presence of drug it is decreased around 46. So this shows the effect of osmolite as stabilizing and effect of drug as destabilizing. Now we have to find out how osmolite is protecting the deleterious effect of drug. So we conducted the third experiment and added the osmolite along with the drug. So which shows the curve is shifting towards the native side. So hence we can conclude, or we can say that osmolite will protect the protein from the denaturing effect of drug. Coming towards the histopathological studies, that is the in vivo studies. So the drug and the osmolite has been administered orally to the rats, male rats, and the animal is sacrificed and dissected. The tissue samples were collected and measured using different standard methods, and histopathological studies has been carried out. First, I would like to show you the histopathological study of kidney. So the picture, the very first part of the picture shows it is a control, that is the untreated one, and the second one is the drug treated, and the third one is the combination of osmolytes. So the kidney tissue shows that in the presence of drug, there is a necrosis and mild interstitial congestion is there, while when osmolytes are added, there is only mild congestion is there. Hence, osmolite protect the tissues from the denaturing effects of the drug. Hence, next is the histopathological study of liver has been conducted. So, in the presence of drug, it shows the necrosis with mild chronic inflammation, while when osmolytes are added, it showed only congestion. So, the tissue morphology is being changed. Next, the histopathological study of lungs. So, when the drug is treated, we can see that it shows the dilation of alveoli with marked interstitial congestion and dense lymphocytic infiltrate. While on the other hand, if osmolytes are being added along with the drug, so osmolite will protect the tissues and it showed only few lymphocytic infiltrate. Moving to the other organ, that is brain. So when drug is treated, it showed only mild hydropic degeneration, while osmolite shows no hydropic degeneration at all. And the last organ I have used here is heart. So in the presence of drug, we can easily see that there is a minimal volume in ventral wall of hearts, while addition of osmolytes shows the slight increase in the volume in the ventral wall of the hearts. So hence osmolyte is protecting the tissue from the tissue degeneration due to the drugs. So I would like to conclude my talk with only one sentence, that is the NSAID destabilize the proteins while osmolite tries to nullify the destabilizing effect of drug. This destabilizing behavior of drug can be seen by perturbed protein structure and stability, and also by altering the tissue structure and morphology. So osmolytes is successfully helping the protein to nullify the effect of diclofenac or the drug. So the take home message will be here that in the selection dose, the combination of osmolite along with the drug is an important criteria and it should be taken in keen interest. With these words, I would like to conclude my talk. Thank you for your time. Thank you.